Hi, I am Dr. Faraz. In the second video, we have studied the effects of midface deficiency in the top jaw. Today, let's have a look at the lower jaw. The lower jaw is the only mobile bone in the human skull. The top jaw is strongly fixed to the base of the skull, but the bottom jaw can move in all the three dimensions. This jaw is jointed to the temporal bone. The distance between this joint and the brain is very short, sometimes even less than 2 millimeters. As opposed to the upper jaw, the length of the lower jaw, the red line, is being dictated by genetics, and it's hardly affected by the environmental factors. However, as you see in these pictures, its shape can be affected by different factors, which I will explain later. A question: as a mobile bone, where does this jaw sit and settle? Can it sit wherever the body likes? Can it stay wherever our muscles feel relaxed? In an adventurous person, the answer is yes, it can. However, in a person who has teeth, this jaw is obliged to sit exactly where the teeth come together. Therefore, if the top jaw is well developed, the lower jaw can come and stay forward. Inversely, if the top jaw is short and staying back, the lower jaw will become locked behind. Another question: in a person with an underdeveloped and short upper jaw and the lower jaw which is locked behind, does the physiology accept it? Can the body adapt with this issue? And if it is against the physiology, how does the body manage it? And which parts of the body will be affected? The answer: this condition is extremely unacceptable for the physiology, and the body fights this issue as a life-threatening problem. The stress from the restricted and confined lower jaw will be directly transferred to three destinations. The first affected site is the lower jaw itself. The lower jaw has to grow to the limits which genetics dictates. And when it's limited on its front side by the top jaw, there is no other option for the lower jaw to grow downward instead of forward. As a result, the jaw angle opens and face height elongates. The second sites which are affected by the caged lower jaw are the joints and the linked muscles. Temporomandibular joint issues resulted headaches and face and ear pain. Now a question may arise: why can't the joint adapt and adjust itself to this new condition and position? For example, why doesn't the body move the joint backward? Because the joint is extremely close to the brain, and as mentioned, the body is very serious in protecting the brain. Unfortunately and sadly, there are many patients all around the world with underdiagnosed joint problems who have been diagnosed with migraine. The last, and certainly not the least important area which is affected is the area behind the jaws. Let's see what we have behind the jaws. There, the most important elements are the airway, the backbone, and the spine. The airway is empty, filled with air, and it has no rigid walls protecting it from collapse. It's like a hose rather than a rigid pipe. When the jaw is not free to come forward, it presses the backside structures. And this empty tube is the most vulnerable part to be affected. So the front wall of the hose is pressed to the back. The tube becomes narrower, limiting the airflow. This air restriction will result in breathing difficulties, snoring, sleep apnea, high blood pressure, and many more troubles, which I'm going to discuss under the sleep topic. Okay, now the airflow has dropped and the blood oxygen starts to fall. Oxygen is the most vital element for the body. Thus, the red alarm starts signaling. Now the body is ready to sacrifice anything else to achieve enough oxygen for the brain. There is no other option rather than pushing the backbone behind. So the vertebrae starts turning. When the backbone starts turning in the neck area, it won't be limited to the top part, as the vertebrae is continuous from the neck to the tail. So even the hip bones can be affected. The person may start crippling. Asymmetries in the body may appear. One shoulder up, another one down. Neck pain, back pain, leg issues, and many more problems. Now let's have a short discussion about the wisdom teeth. When someone chews something hard, the superficial tooth layer, which is called enamel, starts to be worn away. This friction not only affects the chewing surfaces of the teeth, but it also wears away the surfaces between the teeth. It means that during the wearing process, the teeth are getting both flatter and thinner. The wisdom teeth were supposed to erupt when all the present teeth are worn, flat, and thin. But today, the teeth are not grinded enough. And on the other hand, due to the modern lifestyle, the jaw circumference, which is the tooth-bearing area, is not big enough. Imagine, there is a party for 16 people. You and your friend are the last people entering the dining room, and you face a shocking scene. You face a very small table which is occupied and surrounded by obese people. There is not enough space even for the seated guests. Now, what options do you have? This is exactly the same scenario which happens very frequently for our wisdom teeth. That's why the wisdom teeth stay either unerupted or in a wrong position and direction. In the next video, I will discuss the effects of the midface deficiency on our beauty and posture. And then we will have a look at the growth process in non-growing people. Have a great time. See you soon.